Hello and welcome to this FERNE presentation. We will be discussing today seizure and status epilepticus patient guidelines, presenting a simple clinical pathway. My name is Edward Sloan. I'm an emergency physician in Chicago. This information was most recently presented at the 10th World Congress in Emergency Medicine in November of 2022. I'm Professor Emeritus at the Department of Emergency Medicine at the University of Illinois at Chicago in Chicago, Illinois, and I'm Medical Director for the Physician Assistant Studies Program at Dominican University in River Forest, Illinois. I serve as the Medical Director for New Rose Healthcare Management at Roseland Community Hospital, a safety net hospital in Chicago, Illinois. My thanks to the 10th World Congress and mi amigo Carlos Garcia Rosas. He is a great man and a force in emergency medicine. And thank you, all of you who are watching and participating in this educational endeavor. I have no financial conflicts. I serve as the FERNE President and Board Chair, FERNE, the Foundation for Education and Research in Neurological Emergencies, ferne.org. More about FERNE later. The 2020 AES Treatment Committee treatments for refractory convulsive status epilepticus have subsequently helped us to better understand what medications might be used in a third phase of therapies for patients with ongoing seizures and status epilepticus that has now become refractory. This is a publication by Vossler regarding a comprehensive review by the AES Treatments Committee. From this publication, we know it was a structured literature search. The intent was to identify which medications will optimally stop convulsive refractory status epilepticus, knowing that no clear single medication has been identified or established to be superior. We know that convulsive status epilepticus that is not refractory may benefit from fosphenytoin, levetiracetam, and or valproate infusions, all that are viewed to be equally effective. We know that whether or not this same statement is true for convulsive refractory status epilepticus is unknown. And the publication does identify that more convulsive status epilepticus clinical trials are needed. So when considering this convulsive refractory status epilepticus publication, the following are noted: brivaracetam, lacosamide, levetiracetam, valproate, ketamine, midazolam, pentobarbital, and propofol are all supported with limited data in the termination of convulsive refractory status epilepticus. In other words, no single medication has found to be superior to the others for the treatment of convulsive refractory status epilepticus. ACTH, IVIG, corticosteroids, magnesium sulfate, pyridoxine, all have only been used in limited circumstances and do not have clinical data that would suggest their superiority to any other medications. And again, this publication suggests that controlled clinical trials are needed to study the anti-epileptic drugs and anesthetizing agents that could optimally treat refractory convulsive status epilepticus. In this 2020 AES publication, there is a medication table. It includes standard and exceptional meds, that is, meds that are routinely used and those that might only be used in exceptional circumstances. It includes loading doses and maintenance doses. It includes what are appropriate serum levels, if applicable. It identifies serum half-lives when known. And it addresses special considerations such as unique populations, pediatric versus adult, and or what adverse events occur. This is the table from the 2020 AES publication that provides the information that was identified when discussing the previous slide. Thank you for taking the time to learn more about the treatment of patients with seizures and status epilepticus. For more information, please go to the ferne.org website, and also please subscribe to the @FERNE.org YouTube channel. We encourage you to go to all of our social media sites to obtain or to learn what are the most current optimal therapies for the treatment of patients with any neurological illnesses, injuries, and/or emergencies. FERNE.org. If you have any comments or questions, don't hesitate to email us at fern.org@gmail.com. I'd like to thank you, and Ken Moore, listed here on the left, also thanks you for your time and efforts on behalf of patients with emergency illnesses and injuries related to neurological diseases. Once again, Edward Sloan, thank you.